back, and this time we're going to talk about recovery. Now, my surgery day felt like such a whirlwind, and I remember being very nervous, but then waking up and suddenly it was all done. And this is where recovery starts, and this was where I learned the most about patience and listening to my body. So let's talk about what really happens after the day of surgery.
Hi everyone, so your recovery is really the time to get in tune with your body. So let's start from the day of surgery. So breast augmentation surgery is usually a day case here at Pall Mall. You'll have a general anaesthetic and will need a friend or family member to take you home once you are ready.
Yeah, you definitely do need someone to wait with you and to take you home, because when you wake up after surgery, you're going to feel really groggy and quite sore. I know I definitely did.
And that is completely normal from the general anaesthetic. So you'll need to wear a surgical garment, which you will have been advised to purchase beforehand and bring on the day of surgery with you. And this is worn for the first 6 weeks, 24/7. So you'll be advised to sleep upright for a number of nights until you feel comfortable to sleep on your back.
Definitely, and a V pillow or a pregnancy pillow really helps with this. I had one behind me to keep me sat upright, and then I popped another one over my tummy, and it helped support my arms and it stopped me from rolling over because I'm a side sleeper.
And that is a really good tip, that you need to be as comfortable as possible. So here's what to expect after you get home. So week 1, rest as much as possible, but some movement where possible may help to improve the blood flow. Try little walks a couple of times a day, that'll really help as well. Swelling, bruising and feeling heaviness in the chest area and tightness are common, so try not to worry about that too much.
No, exactly. I remember describing it like feeling like someone was sat on my chest. If you are worried though, you do always have the ward number and an out of hours number, so you can always contact us. And I found week 1 the hardest physically because I'm a busy mum, but it's so important to slow down and to make sure that you have lots of help at home.
You're absolutely right. So if we look at week 2 to 4, you can return to light activities and pain will have decreased significantly.
Yeah, and week 3 for me was when you can start to get back to driving and even return to work, as long as it's not a heavily manual job.
4 to 6 weeks, most can resume to some light exercise but no heavy lifting until 6 weeks. Always follow your surgeon's advice on that one.
Now, I know getting back to exercise was a big one for me, but it's just not worth risking your results by going back too soon.
Absolutely. So also you might have heard the term drop and fluff. This is when the implants settle into the breast pocket and the swelling goes down. So it leaves a softer, more natural result. So please be patient and trust the process. It can take between 3 to 6 months, and often the left breast may settle at a different pace to the right breast, which is completely normal. With time, they will even out nicely.
And definitely, mine healed at completely different times and speeds, and it can feel quite worrying, but knowing it's completely normal will put your mind at rest. Now, the next thing I worried a little bit about was scarring as well.
Most people do, so it is normal to worry about that, but the scarring does fade over time, and it usually is hidden under the breast crease or around the areola, depending on incision type. So don't worry. You will have your aftercare appointments at 1 week, 2 weeks and 6 weeks to check your healing. So we do also provide you with our 24/7 nurse helpline for reassurance as well.
Yeah, and our nurses are absolutely brilliant and they're so experienced. Now, they helped me out a number of times and they're always happy to answer any questions that you have, and that's what they're there for.
So I mentioned it before about your compression garment and needing to wear your bra. So we recommend Macom branded post-surgical garments, and these are needed to be worn for the 6-week recovery period, even with sleeping. So this is just to help you get the best results.
Now, I found the first week the hardest, like I said before, and that's just because I'm used to being up and on the go. But having the aftercare team check in with me made such a difference, and they reminded me that it is okay to slow down and to let your body heal. And by week 3, I felt so much more comfortable. It really is just a journey and a process.
Exactly. And everybody heals so differently. So some women may feel fine quickly, others may need more time. The key is listening to your surgeon and not rushing back too soon. Wearing your garment even beyond the 6-week point, sometimes just at night, can also help give you the best long-term results.
Definitely. I mean, I'm 12 months on and I still wear mine. So, recovery is just as important as the surgery itself. And don't forget that we've got lots more videos about possible complications and risks, and even talking about pregnancies and breastfeeding.